Welcome to G Fun Facts Online. Let's talk about something that isn't very fun. Your health insurance bill. Have you ever looked at it and felt a pit in your stomach? You see the monthly premium you pay, but then you see another, much scarier number, the deductible. That's the amount you have to pay out of pocket, sometimes thousands of dollars, before your insurance company really starts to cover the costs. It feels like you're paying for insurance that you can't afford to use. Today, we're going to decode why this is happening. Why are health insurance costs and deductibles spiraling out of control? The answer is a complex web of technology, drugs, demographics, and some very unique features of the American healthcare system. First, let's nail down what a deductible is. It's a set amount you pay for your medical bills each year before your insurance plan starts paying. If your deductible is $2,000, you are on the hook for the first $2,000 of medical costs. Only after you've paid that does your insurance start sharing the bill. Now here's the shocking part. Back in 2006, the average deductible for a single worker was about $379. Fast forward to today, and that number has exploded. The average individual deductible is now nearly $2,000. That is a massive shift of financial risk directly from the insurance companies onto you, the patient. A big reason for this is the boom in high-deductible health plans, or HDHPs. You've probably seen them offered by your employer. They tempt you with a lower monthly premium, which sounds great. But the catch is that massive deductible. In 2023, more than half of all private industry workers were enrolled in one of these plans. They're great if you're perfectly healthy and never see a doctor. But for anyone with a chronic condition, or who has an unexpected accident, that high upfront cost can be financially crippling. It leads many people to do something dangerous, delay or completely avoid getting the medical care they need. But rising deductibles are just a symptom. The real disease is the relentless inflation of healthcare prices themselves. Insurers are raising deductibles because their own costs are going up. So let's peel back the layers and look at the powerful engines driving up the price of everything in healthcare. Our first driver is the high price of progress. Medical technology has given us incredible tools. We have MRI and PET scans that can see inside our bodies with amazing detail, robotic surgery that performs miracles, and drugs that can change the course of deadly diseases. This is the double-edged sword of modern medicine. In most industries, technology makes things cheaper over time. Think about computers or TVs. But in healthcare, new technology almost always makes things more expensive. A single MRI machine can cost up to $3 million, and that's before you factor in maintenance and training. Hospitals pass these costs on to you. Plus, when a hospital buys a fancy new machine, there's pressure to use it to justify the cost. This is called supply-induced demand. It means more tests and procedures are done, sometimes even when a cheaper, older method would work just fine. Revolutionary treatments like CAR T-cell therapies for cancer can save lives, but they come with price tags in the hundreds of thousands of dollars, adding yet another layer of cost to the system. Next, let's talk about the pharmaceutical factor. Prescription drugs are a huge and fast-growing piece of the healthcare spending pie. A major reason for this is the rise of what are called specialty drugs. These are high-cost medications for complex conditions like rheumatoid arthritis, multiple sclerosis, or cancer. They can be life-changing, but their prices are astronomical, often tens or even hundreds of thousands of dollars per patient per year. Here's a mind-bending fact. Specialty drugs make up only about 1.4% of all prescriptions filled, but they account for a staggering 34.6% of total drug costs. Now, drug companies say these high prices are needed to cover their massive research and development costs, and they get 20-year patents that let them sell without competition. But there's another player in this game: pharmacy benefit managers, or PBMs. These are middlemen who negotiate drug prices for insurance companies. In theory, they should be getting lower prices, but their business model is controversial. They often get rebates from drug makers, and this rebate is usually a percentage of the drug's list price. This creates a bizarre incentive for PBMs to actually favor more expensive drugs on their approved lists, because a bigger price tag means a bigger rebate for them. This practice, along with others like spread pricing, where they charge the health plan more than they pay the pharmacy, keeps prices high and the whole system incredibly opaque. The third major driver is a demographic shift. We are an aging population. By the year 2060, the number of Americans aged 65 and older is projected to nearly double. Older adults naturally have more extensive healthcare needs. They are far more likely to have chronic diseases like heart disease, diabetes, or cancer. About 84% of people over 65 have at least one chronic condition, and managing these requires constant medical care. The numbers are stark. People 65 and older make up just 13.5% of the population, but they account for over 45% of the top 10% of healthcare spenders. And it's not just the elderly. Today, half of the entire US population has at least one chronic disease, and care for these conditions eats up over 85% of all our healthcare dollars. The cost of diagnosed diabetes alone in 2022 was an estimated $413 billion. As our population gets older and chronic diseases become more common, the demand and the cost of healthcare will only continue to climb. Our fourth driver is market consolidation. Put simply, hospitals are buying each other. Between 1998 and 2021, there were nearly 1,900 hospital mergers in the United States. The argument is that this creates efficiencies. The reality? Research consistently shows the opposite. When hospitals merge, it kills competition. The new, giant hospital system has immense bargaining power over insurance companies. They can demand much higher prices for their services, and the insurance companies have no choice but to pay. Where does that money come from? They pass the cost right on to you, through higher premiums and higher deductibles. Studies have found that these mergers can increase the price of hospital services by anywhere from 6 to 18%. One study estimated that the average number of mergers per year between 2010 and 2015 raised private health spending by over $200 million in the following year alone. Finally, let's talk about a uniquely American burden: administrative costs. This is all the money spent on billing, insurance, paperwork, and other non-clinical tasks. In the United States, this accounts for a mind-boggling 25 to 31% of total healthcare spending. That is more than double what a country like Canada spends per person on administration. The reason is our incredibly complex multi-payer system. We have hundreds of private insurance companies, each with thousands of different plans, and every single one has its own rules for billing and getting approval for care. This creates a mountain of bureaucratic red tape for doctors and hospitals. One study found that physicians spend almost twice as much time on desk work and paperwork as they do actually seeing patients. All of this inefficiency and complexity isn't free. We are all paying for it through our premiums and deductibles. Now, there's an economic theory behind why companies push those high deductible plans. It's called moral hazard. The idea is that if you're insulated from the true cost of something, you'll use more of it. So, if your insurance covers everything, you might go to the doctor for every little sniffle. High deductibles are meant to make you a more price-sensitive, smarter healthcare consumer. But in the real world, it's not that simple. Studies show that when faced with high out-of-pocket costs, people don't just skip unnecessary care. They are just as likely to skip essential care. They stop taking their blood pressure medication. They put off cancer screenings. This can lead to much worse health outcomes and even higher costs down the road when a manageable problem becomes a catastrophic emergency. Besides, you can't exactly shop around for the best price on an appendectomy when you're doubled over in pain. So is there any hope? The situation is dire, but there are promising trends. One is the shift to value-based care. Instead of paying doctors for the quantity of services they provide, this model pays them for the quality of the care and the health of their patients. It incentivizes keeping people healthy, not just treating them when they're sick. Another is the push for price transparency. New rules are forcing hospitals to post their prices publicly. It's a messy and slow process, but it's a first step toward empowering consumers. Finally, the rise of telehealth, accelerated by the pandemic, offers a more convenient, accessible, and potentially cheaper way to deliver care, especially for routine check-ins and managing chronic conditions. In the end, the crushing weight of your health insurance deductible isn't just one thing. It's the combined force of expensive technology, complex drug pricing, an aging population, a lack of market competition, and a mountain of administrative waste. Fixing this won't be easy, but understanding the real drivers is the first step toward building a healthcare system that is not only innovative, but affordable and accessible for everyone. Because our health, both physical and financial, depends on it. Thanks for tuning in to Fun Facts Online.